When we think of rheumatoid arthritis, we usually think about joint pain. But did you know that rheumatoid arthritis can affect other organs of the body? So today we're going to be going over the complications of rheumatoid arthritis beyond just the joints. Hi, I'm Dr. Micah, board certified integrative rheumatologist. And today we're going to talk all about rheumatoid arthritis. Not just rheumatoid arthritis of the joints, but of the other organs as well. And by the end of this video, you might know more than your typical doctor about rheumatoid arthritis. Rheumatoid arthritis can come on suddenly and can come on very, very slowly. Everybody's a little bit different. And can you have rheumatoid arthritis without having joint inflammation and swelling? Yes, I'm here to tell you that I've seen in my own professional career patients with rheumatoid arthritis affecting the organs only outside of the joints. So sometimes the joints come afterwards. So everyone's a little bit different. I still remember a case as a fellow in rheumatology, and it was a case about a patient that came into the ICU with shortness of breath. And the case was so severe that the patient had to be intubated. So what that means was that the patient had to have a tube placed down the trachea or the breathing tube in order to get sufficient oxygen and breathe. And at the time, the ICU doctors did not know what was going on. So they ran a bunch of labs. What they found were rheumatoid arthritis antibodies being very high. So they called us as rheumatologists to come in to see what was going on, to see what else could have caused the issue. And upon talking to the family, the patient had no joint pains whatsoever. And the final diagnosis was rheumatoid arthritis affecting the lungs. So this was a very interesting case, and a case that has stuck in my mind over the years because it just tells me that rheumatoid arthritis doesn't always have to strike the joints. It can be seen and manifest in other organs as well. And what do you think the leading causes of death in rheumatoid arthritis are? Well, I'll tell you that it's not from joint pain, which is what most people would think. The leading cause of death are infections, lung disease, and also heart disease as well. And did you know that rheumatoid arthritis patients have twice the risk of having heart disease compared to someone that doesn't have rheumatoid arthritis? So these numbers and facts might shock you, but they're quite true. And the reason why I'm giving this talk today and this video on the complications of rheumatoid arthritis is because you need to know what can potentially happen and look out for these signs, because sometimes doctors don't catch it. Even rheumatologists sometimes don't think of these complications because they're not that obvious in the patient in front of them. So you need to be aware as a patient yourself or know someone that's a patient so that you all can look out for these complications. So let's talk about the serious complications of rheumatoid arthritis. And number one, I want to talk about heart disease because it is so common. The heart can be seriously involved in rheumatoid arthritis because there's inflammation throughout the body. Rheumatoid arthritis is a systemic autoimmune inflammatory condition. And rheumatoid arthritis can contribute to heart attacks even when cholesterol levels are normal. This is because the inflammation, like I said, is throughout the whole body, not just of the joints. Rheumatoid arthritis can also cause something called myocarditis, which is inflammation of the heart muscle. So this is a little bit different from heart attacks. And one of the ways to detect myocarditis in rheumatoid arthritis is through something called a cardiac MRI. So it's like an MRI machine that you go through, but it has a special protocol called a cardiac MRI where it focuses on the heart. I've seen a couple of cases of rheumatoid arthritis causing myocarditis, but it is uncommon. And the treatment is to aggressively treat the rheumatoid arthritis. The second organ and complication that I want to talk about is the lung and lung disease. Rheumatoid arthritis can cause inflammation and scarring and fibrosis of the lungs, and this is called interstitial lung disease. There's many subtypes of interstitial lung disease which I am not going to go into today, but these can be very, very serious. Interstitial lung disease, also known as ILD, can be quite serious and can cause shortness of breath, and in my previous story that I talked about, can cause patients to go in the ICU and needing a breathing tube to or help them breathe. And some patients do need to walk around with an oxygen tank with them so that they can get enough oxygen in the body. It can be quite debilitating. So sometimes my patients come in and I do ask them, are you having shortness of breath lately? Because if they're having shortness of breath without any exertion or minor exertion, that tells me that rheumatoid arthritis can be potentially affecting their lungs. And one of the ways to diagnose it is to first start with a chest x-ray. So chest x-rays don't always identify interstitial lung disease, but it's a first step and it's the cheapest imaging test that we have. If that doesn't show anything, usually I proceed on to a CT scan of the chest to look for interstitial lung disease. And I also get something called pulmonary function test. A rheumatologist will work alongside with a lung doctor, also known as a pulmonologist, in order to work on the interstitial lung disease of a rheumatoid arthritis patient. So you can see it gets quite complicated here. Let's talk about the eyes. So rheumatoid arthritis can affect the eyes, and that's quite surprising for a lot of people. And some doctors don't even know that because it's more of a rheumatology specialty and a ophthalmology complication as well. So at the most benign level or less risky level, less serious level, is rheumatoid arthritis causing dry eyes. Some patients that come to my office will say, Dr. Yu, I'm getting dry eyes. So I'll say that could be a rheumatoid arthritis, and it could also be something called secondary Sjogren's, where a patient has Sjogren's disease and can have RA involved as well, and that will be two diseases in one. So we call it rheumatoid arthritis with secondary Sjogren's, or something that could just be rheumatoid arthritis itself. And usually we just use eye drops to help with the situation. However, there are more serious complications of the eye from rheumatoid arthritis that can cause a lot of pain and potential blindness as well. So there are several parts of the eye that can be involved, and there are a couple of complications such as scleritis and episcleritis in RA. So when patients get inflammation in the white part of their eye, which is called the sclera, and it causes a severe attack, it's called scleritis. And scleritis can have eye redness, eye pain, and sensitivity to light. So I've seen these patients come to the ER before, and these patients come with an acute attack of the eye, and there's no time to go to the rheumatologist or the ophthalmologist sometimes, so they go straight to the ER. Or sometimes it's been happening for days, but the patients don't know about the signs, so they live with it for a couple of days until it's unbearable. So that's something very, very severe, and it does need an ophthalmologist to diagnose this. A rheumatologist typically does not diagnose scleritis. Also, there's something called episcleritis as well, which is very similar, but it's less severe. And again, we need an eye doctor to diagnose this. Keratitis is another manifestation of rheumatoid arthritis, and this complication mainly affects the cornea of the eye. And another serious complication is called optic neuritis, where the nerve is involved in rheumatoid arthritis. So the nerve of the eye is involved, and that can lead to blindness and visual changes. The treatment for all this is aggressive treatment with rheumatoid arthritis. So yes, I talk a lot about holistic treatments, diet, all these things are really important and foundations to treatment for RA on top of medications. But when these complications are in place, I would say with 100% certainty that medications are absolutely vital here to fight these diagnoses because they're very, very severe. Next, let's talk about the skin. Yes, the skin can be involved in rheumatoid arthritis, and yes, it's outside the joints, but it can still be involved. With the skin, there can be something called rheumatoid vasculitis, where the vessels are inflamed, and that can cause these discolorations, these rashes that take place. So these rashes can be very painful, they can be very itchy, it can look purplish and reddish at the same time. And of course, rheumatoid vasculitis can affect different organs of the body as well, but we're gonna focus on the skin in this section. And also, there's something called pyoderma gangrenosum. That is basically ulcerations of the skin, and it can be very, very serious. And this can be associated with rheumatoid arthritis also. When we see rheumatoid vasculitis or pyoderma gangrenosum, for example, we usually use steroids and or biologics at the same time. There are certain conditions where we absolutely have to use medications, and these are just some of the conditions. Yes, I know I like to promote diet, a healthy lifestyle in order to fight rheumatoid arthritis and different autoimmune conditions on top of medications. So this is one of the scenarios that I said we absolutely have to use medications. And eventually, if things get better, we can scale back on the medications. There's also another skin manifestation called rheumatoid nodules. And rheumatoid nodules are firm lumps under the skin. They can be around the joints or other parts of the body. And those are usually made up of inflammatory tissue. This is another scenario where medications can really help in minimizing those rheumatoid nodules. And that's a complication. We don't see that all the time. But I'm sure some of you that are watching this video may have rheumatoid nodules. Now that we're done talking about the skin, let's talk about the nervous system. Yes, the nervous system can be involved in rheumatoid arthritis. So we can get something called peripheral neuropathy in rheumatoid arthritis, where we get tingling and numbness of our extremities. And we get this because RA is a systemic inflammatory condition. And that's one of the more mild manifestations of the nervous system. However, we can get something even more extreme called mononeuritis multiplex. And I would say this is one of the more serious complications of RA in terms of the nervous system. And what mononeuritis multiplex is basically a nerve or a group of nerves that are seriously involved and inflamed. And when this happens, the wrist drops and the foot drops as well. Because of the inflammation, we can't extend the hand or the foot. And it does take biologics and medications to get this better, and steroids as well. So usually when this happens, it is a visit to the ER, and I've seen patients with these in the hospital as a complication of their autoimmune condition, including rheumatoid arthritis. So the next area of involvement with rheumatoid arthritis that I do want to talk about, and I do not want you to skip over this, is the neck. This is probably the most serious condition of all of them that can potentially manifest in a very deadly way. And I want you to know this because doctors can overlook this. So please pay attention here. So the neck can be involved in rheumatoid arthritis. So when a patient walks into my clinic, not only do I ask them about their hands and feet, but I also ask them about their neck pain. So the neck can be very mild. It can be just wear and tear, such as osteoarthritis. But rheumatoid arthritis can cause inflammation of the vertebra, especially of the neck. When there's rheumatoid arthritis involvement of the neck, sometimes the cervical spine, sometimes the vertebra in the cervical spine can get narrow from loss of cartilage. But over time, there can be something called erosions, which are holes on the sides of the bone, of the joint specifically, from the inflammation. You can get these also in your hands, your feet, and other extremities as well, but you can get this of the neck. And also, the ligaments of the neck can weaken. And over time, the vertebra of the cervical spine can be misaligned from the weak ligaments. And because of the looseness of the vertebra from the weak ligaments, there can be spinal cord compression. And when that happens, it can lead to paralysis, or worse yet, it can possibly lead to death. So please pay very close attention to this. So if you're having neck pain, you have rheumatoid arthritis, don't forget to bring that up to your doctor. When these conditions do happen, there's laxity of the ligaments, and the neurosurgeon is consulted and they see something's wrong on the x-ray or the CT scan and the MRI, sometimes surgery is involved. So please be aware of that, and I don't want you to miss this. And I've seen cases like this in the hospital from very serious rheumatoid arthritis, which is why when there's repeated pain and inflammation, we do want to pay close attention to this and consider medications if we're not on that already. And on top of the paralysis, before that even happens from the spinal cord compression, we can get weakness, bowel or bladder problems, difficulty walking, balance issues, and this all happens from the spinal cord getting slightly compressed from all the inflammation and from the weakening of the ligaments of the neck. So their vertebra is compressing it. Alright, so the final serious involvement of rheumatoid arthritis and I want to talk to you about is something that we talk about in medical school, which is something called Felty Syndrome. Felty Syndrome is made up of a trifecta of 3 symptoms that we don't want to miss here. Number 1 is arthritis in rheumatoid arthritis, so severe joint pain. Number 2 is a low white blood cell count. And number 3, an enlarged spleen. So Why does this happen? We're not quite sure yet, but this is a complication of serious rheumatoid arthritis. And the low white blood cell count can lead to increased infections. And also with an enlarged spleen, it can eat up our blood cells such as platelets, and it can cause anemia as well. Also, the spleen can rupture from being enlarged, and that can be life-threatening. So there's something not to miss if you have serious rheumatoid arthritis. And your rheumatologist will know this, they look out for it. So when I see a rheumatoid arthritis patient in my own clinic and they have a low red blood cell count consistently, I start thinking about possible Felty syndrome, but it's quite uncommon and I don't see it quite often. And the treatment for this is rheumatoid arthritis medications. It's not much different from the other medications we give for regular rheumatoid arthritis, but there is a group of medications we focus more on. So I know that these group of signs and symptoms of serious rheumatoid arthritis can sound quite scary and serious. However, I want you to know that they are avoidable if we can control the inflammation. Some of us may manifest these symptoms without any joint pain at all. But working with a rheumatologist is very important here. So I would recommend not to ignore seeing a rheumatologist if you're experiencing rheumatoid arthritis and or any of these serious symptoms. So let me know what you think and tell me what I may be missing in this video. I think I covered quite a lot of different organs here. So if you like this video, please comment below, like this video, and subscribe to my channel so you keep learning more about rheumatology, autoimmune disease, and integrative medicine, because I love talking about diet, supplements, and other alternative therapies in this channel. And if you want to learn more about integrative medicine, don't forget to watch this next video so you keep learning with me. I'll see you guys next time.